Hullo UT. This is Dr. Vibes, a learning point. If you haven't subscribed the channel, please do so because it really takes a lot of efforts to make the videos. Now let us study about the diagnosis of chronic ITP. Now this is a stepwise diagnostic process which needs to be followed. First, there will be examination of peripheral blood smear. Examination of peripheral blood smear. What will you see? You will see RBCs, you will see WBCs, you will see platelets, and you will see reticulocytes. Now come on, think. What will happen to RBCs? What is going to happen? Is there any problem in RBC? No. That means normocytic RBCs are formed. Normocytic RBCs are formed. But yes, plus mild anisocytosis or oikilocytosis can be seen. Correct? WBCs, TC and DC in normal limits. There is no obviously this is not an RBC or WBC disorder, so these will be normal. Platelets. What will happen to platelets? Very, very important. Decreased platelet count. Decreased platelet count. Clumps not seen, but giant platelets observed. What will happen to reticulocytes? Almost normal, but may show a mild increase. Correct? Next, examination of bone marrow aspirates. Bone marrow aspirates. What you are going to see? You will see increased cellularity. Why? Because there is decreased platelet count. So the megakaryocyte will try to compensate this decreased platelet count. So they will increase, they will tell the bone marrow, to increase the platelet count. So you will see increased cellularity. Then you are going to see normal leukopoiesis. But you may see mild erythroid hyperplasia. Why? Because bleeding is occurring. So RBCs will be increased. Next up, very important, you have the increased number of megakaryocytes. But majority of them are immature or inactive. And this is characterized by HAC, okay? Cytoplasmic vasculations, absence of budding, and hypolobation. Okay, this is the bone marrow examination. Now we have tests for bleeding disorders. Now you have tests for bleeding disorders. Okay, BT, bleeding time. What will happen? Tell me. Platelets are less, so platelet plug formation will be delayed. Bleeding time will be increased. Clotting time will be normal because this depends upon the clot formation, and that is mainly due to the coagulation pathway. And this is not related to primary homeostasis. So coagulation time is normal. Prothrombin time and activated PTT is also normal because again they are based on the factors of the coagulation pathway. That is secondary hemostasis. So PT and PTT will be normal. But Tourniquet test, which is a test for bleeding disorders, this will be positive. Okay. Next, peripheral blood smear done, bone marrow aspirate done, bleeding disorders test done. Now what you have to do? Identification of anti-platelet antibodies. Okay, and this is IgG type. And finally, the fifth step that you are going to do is look for the cause. Like if it is primary, then this is idiopathic, cause is unknown. But if it is secondary, then as I said, this can be due to HIV infection, B-cell neoplasm, or SLE, systemic lupus erythematosus. So this is about the diagnosis of chronic ITP.